I'm a geriatric psychiatrist. That's my main work, and so work with patients a lot with dementia and patients with older adult depression, anxiety, and a whole variety of mental health issues as they are older. So yeah, that's where I come from. Many times, people would assume that by the virtue of you having a diagnosis of, let's say, mild cognitive impairment or dementia, or maybe a certain score on these screening tests like a mini mental status or Montreal cognitive, they automatically cannot make decisions. First of all, don't make that assumption. I think the first step is to say, can they actually still make that decision? Because if they cannot, that's when these acts become in play, because the law states everyone is presumed capable until proven not. Capability is determined at the moment. I mean, we take information from the past to inform what we should decide right now. But sometimes for certain patients' condition, those abilities also change. Dementia is such a diverse condition, really. There's many different causes. Off the top of my head, there's 20 plus causes, each of which will present differently, each of which may impair particular domains of the decision making differently, and each progress differently. And also everyone's severity of the disease varies. So you're talking about a very diverse population. I think a lot of the mistakes, and when I have learners with me, I think one of the main things I always talk about is how always remember your care is for the patient. So always, no matter how far they are, how severe the dementia is, always approach the patient first. Don't forget that. Don't ever forget. You are here for that patient. Everyone else is here to help you out on things, but that patient is your duty. So make sure we always try to engage as much as we can about that particular patient first. Make our own informed decision on how much we think they are able to understand the information that will be given, whether they are not able to at all. Have our own real understanding rather than just hearsay and make assumptions on that. So that's number one step. I think we should make sure we always approach the patient first. How do they receive information the best way? How do I modify the way, rather than just talking to someone, how do I modify it in a way that they can actually take the information in? Because after all, if no information goes in, forget whether you have memory problem or not, you won't understand anything. And always ask them back about what do they understand. Because if sometimes old adults can be very clever, they pretend they heard what you said, not really wanting to be, lying about it, but just that, they don't want to have to ask someone to repeat it all the time. They probably got, negative feedback in the past, so just be aware of that. Because when they do that, then you can have your opportunity to say, actually what we meant was this. And sometimes that miscommunication and whatnot can be the difference maker between them, just kind of going along with the decision of what everyone else thinks is the best for them anyway, versus them very, resistive against certain decisions. So I think information is power. Really, if we can empower them with as much information as possible, then we maximize their chance of making their own decisions. Sometimes you don't actually need to do a capability assessment. It's about working with them, giving information to them, and while you give information to them, just also be mindful of where they are at. Maybe it's understanding the era in which they grew up. Long-term care looked very different back then than today. Understanding that there was no concept of assisted living back then compared to now. Understanding that they may use different languages. Back then you may need to use more simpler language depending on the educational level. You might need to have someone that is a bit more forgetful. You might need to want to have written information, repetitions to them. Ask them what they understand of what you just told them, because those are all ways to ensure that they got the information. And also the other thing that's really key as well is just from the get-go is make sure they can take in what you're saying. Many old adults, sometimes if you're not careful, they have significant visual impairment, significant hearing impairment, and if you don't address those, you have no luck of getting information in. So make sure we maximize their potential of taking information in, and they may surprise you. They may really well know, oh, I understand this now. Now that I understand this is my choice, right? And always just go back to the patient. I think that's the main message I think we should have. Always keep the patient in mind. I really think at the end of the day, it kind of comes down to you have to basically assess the individual. It's very individually based. You can't really say on broad stroke, this is going to be, yep, you already lost every decision. They might have lost decisions in certain domains. Maybe they're not as good in driving anymore. But that doesn't mean they don't know how to finances. It doesn't automatically mean they don't know where they should live safely. So a lot of it is just kind of tailoring back to this. Just remember, these are diverse populations, tailored to the particular individual that you're dealing with, and ask yourself, what decision am I trying to probe right now? Because all those would change whether a person is capable or not. Ultimately, we want to respect as much autonomy as possible. And if there are people that I've seen that do make not the best decisions, and they should be allowed to do that based on our, constitution in Canada. People are allowed to live at risk. We have to understand that it may not sit right with us because historically medicine is practiced in a very paternalistic way, but we are in the almost 23rd century now. We are supposed to be practicing in more modern ways of doing it, so we need to respect autonomy. That's written within our kind of code of conduct as a physician nowadays. Respect autonomy first.